Welcome back to New Jersey Viewpoint. I'm Ken Rosado. The percentage of children needing eyeglasses has reached epidemic proportions in certain parts of the world and has increased dramatically right here in the U.S. Today we have with us an eye doctor who has written a book that deals with nearsightedness. He became interested in this topic after his two young sons needed eyeglasses at the age of 7. Please join me in welcoming Dr. Nicholas Despotidis, an optometrist who is the co-founder of Eye Care Professionals in Hamilton Square, New Jersey. And Aspen Kinsler, a second grader who is a patient of Dr. D, as the kids like to call him. Nice to call you that. It's easy. I'm having difficulty saying your name, so we'll call you Dr. D if that's okay.
That's great.
First off, tell me about the book more, and when you found out and thought about, wow, my kids are only 7 years old needing glasses. Was that the ultimate impetus of writing that book?
It really was, because for 20 years I would prescribe glasses like most optometrists. But when my own children started to develop nearsightedness or myopia, I was really taken back. And that was the impetus of writing the book. Why is this happening at such an early age, and what can we do as parents to prevent it from happening?
Okay. What is corneal reshaping now?
Now, corneal reshaping is one of the techniques that I discuss in the book that corrects vision with a lens. It's very similar to a contact lens. And the child or the patient puts it in their eyes before they go to sleep. It's specially made. And as they sleep, it re-corrects their vision, readjusts it. And the child takes it out in the morning, and they're able to see 20/20 vision. And what they found, incidentally, that it slows down the progression of the nearsightedness, so that it has a dual role of correcting the vision and perhaps slowing it down from getting worse.
So this is similar to what braces are for teeth?
That's correct.
It reshapes. Now, if the kids stop using that contact lens, if you will, will it just drift back to where it was?
It will. Okay. So you put them on nightly. So my children who are now adults, they put them on every night right after they brush their teeth, and take it out in the morning, and they're all set for the day.
Is there an age limit?
No, there really isn't.
Do this.
We have patients in their 60s that wear them.
Wonderful.
But for children, there's a dual benefit. It perhaps slows down their eyesight from getting worse, like in Ashley's case, and Aspen's case, and it also allows them to see 20/20 all day.
Let me ask Aspen, what is it like putting these on at night? You do it yourself?
Yes.
How difficult is it?
Not that hard.
How long does it take you to do that?
Maybe about 30 seconds.
That's it.
So.
And what would you tell any other kids out there who are worried if they have to get them?
It doesn't hurt, and you can live with it all night.
There you go. It doesn't bother you when you sleep or anything?
No.
Well, you got beautiful eyes, too. I'm so glad that you got those to keep your eyesight nice and clear, and you could see just fine now.
Yep.
That's really good. Fantastic. Obvious testimony from the expert there. There are some other things that we can do to minimize the progression of myopia in children. What are they?
Yeah, we're noticing more and more children are wearing glasses at much earlier ages. Aspen is now 8 years old, and she started wearing them when she was about 5 years old. So what I encourage my patients to do when I tell them, when they ask me what can I do to help my child's eyesight, is number one, I tell them to play outside. You have to play outside. Right now, there's so many electronics keeping our children indoors, the TV, the computers. Number two, I tell them to basically have good posture. When they're reading, keep the book 14 inches away from you. Gotcha. Hold things, stand correctly. Don't lay in bed. Use good lighting. You know, you don't want to read in a dark room.
I love this eat low sugar and simple carbs. You're killing me here. What does that have to do with it?
Well, that's really important, because I think our children's diet has changed through the years, certainly from when we were younger. So we want to avoid the simple fast foods if we can, good wholesome foods, things like that, you know, fruits, vegetables, that sort of thing.
And the lowering salt intake and fatty intake, et cetera. It sounds almost like any good healthy diet.
It really is. And as a society, we're getting away from that because we're running here, running there, including myself. So there's fast food everywhere, but we really want our kids to eat a very well-balanced diet.
Now, what is the study that was recently conducted that showed the link between nearsightedness and scholastic achievement in kids?
Yeah. We used to think that nearsightedness or myopia was primarily genetic. If your parents wore glasses, then the children wore glasses. Well, now we see that a lot of children are wearing glasses even when their parents never wore glasses, or they wore them later in life. And what we found is there's a link to scholastic performance or academic performance And the more a child sometimes strives for academic excellence, the more likely they are to wear glasses. And that's why more and more children are wearing glasses at such early ages.
Well, the question then becomes, is it because they're reading more and reading incorrectly, too close to the page, etc., or is there some genetic component or some other link?
There's probably both. There's an environmental and there's a genetic one. But we know this, whether it's because they're reading, like you said, in poor posture or their diet's off, we know they're staying indoors too much. And one of these landmark studies have said our children have to get back outdoors. Because no matter where you live, it seems less and less children are playing outdoors, and they're playing indoors. And it seems that indoor play is contributing, whether there's a genetic factor or not, to their eyesight getting worse.
Yeah, and you got to wonder, does that mean the ultraviolet light of the sun is helping?
Yeah, that's right. That's what, yeah.
Get
absolutely.
some sunlight on the eyes, just
that's
a little
right.
bit.
Absolutely.
That's an amazing thing. Hopefully we'll learn more about that as they do more studies, but that is fascinating to see that, because yeah, you're right. It was the one child in the classroom that used to wear glasses, and now you have a whole classroom full of children.
Absolutely. But if you remember, there wasn't much for us to do when we were younger. If you had the TV, there were 3 channels on the TV. Now there's dozens, and we have so many things keeping us indoors.
We here at Channel 7 liked it when there were only 3 channels on the TV, I'll have you know. Oh, we still like it, fortunately. It's, you know, TV has certainly its place in this world, but in moderation, just like everything else. Candy bars are fine, too, in moderation.
That's
everything
right.
should be done in moderation.
Right.
So what does this mean now? For the rest of your life, you're going to be just fine putting these in your eyes at night?
Yes.
Okay, because you like the idea of showing off those gorgeous eyes during the day without glasses. Although not that there's anything wrong with glasses. I wear glasses.
Yeah.
So you cover all these bags under my eyes. You don't have bags under your eyes. That's a good thing.
You know, Aspen's eyesight was really bad at 5 years old. She couldn't even see the big E. And she does a lot of activities. Do you want to tell?
Like gymnastics, ballet, piano.
Piano.
And you don't need glasses or contact lenses now because of it.
Yep.
That's a good thing. It is so nice to have you both here today. Thank you so much for coming in this morning.
Thank you.
Much appreciated. And so the future, we hope, will find some at least definitive links so that we know how to treat. But in the meantime, this corneal reshaping sounds like a brilliant concept.
It really is.
And any parent could go to their eye doctor and talk about this.
Absolutely. Absolutely.
Well, Doctor, I want to thank you so much for being with us today.
Thank you.
It's wonderful to have you on Viewpoint today.
Thank you for having us.
I'm Ken Rosado. We thank you again for joining us and invite you to enjoy the rest of your weekend.